My understanding was that the expectation was that those numbers would increase. And I didn't lick that off the rocks. I got that directly from the Minister for Health, who himself in this studio said to me that what they were predicting was that mid-October, and it's hard to be any more mid-October than we are now, was when we would see the peak in COVID cases.
Cases, unfortunately, they've been stable for the last while. But yes, the modelling team believe they will continue to rise.
The case rate that you are predicating those decisions upon peaks when?
Depending on the scenario, but peaks roughly mid-October.
Peaks mid-October?
Yeah.
So we are going to see case numbers increase. The current projections are we are going to see case numbers increase for another 5 to 6 weeks.
Yeah, under 3 of the 4 scenarios that we've been presented with by the modelling group, cases will continue to rise until mid-October. Schools going back, colleges going back, people going back to workplaces.
Well, that's the Minister for Health, Stephen Donnelly, speaking a number of weeks ago, and it turns out that those predictions made in 3 out of 4 of the models have come to fruition. We now see a situation where there are 11,755 confirmed COVID cases over the past 7 days, 413 people hospitalised, 73 patients in ICU. All of which, though, would seem to fit with what the expectation was. 53106 if you want to get in touch. We are joined by Deirdre Robertson, who is a researcher with the Behaviour Research Institute in the ESRI. And the ESRI has been looking at what are the sort of the public health behaviours that are either contributing to or militating against the spread of COVID. And the kind of things that you've been seeing, Deirdre, is there much in the way of a reduction in personal responsibility? Are people still washing hands? Are people still wearing masks?
So we've been collecting this data every 2 weeks since January, and we've been asking things like that. Are you wearing masks? Are you washing your hands? And also, where are you going? And what we've seen is a steady increase in the number of locations that people are going to, the places they're going, the number of people they're meeting, and then also a decline in the extent to which people are wearing masks always or being well ventilated. Particularly, we saw a few months ago, in people's homes, people were starting to be a bit less careful when they were visiting other people. Now, of course, that also corresponds with restrictions lifting. We haven't ever seen a big increase in the number of activities that people are doing or a sudden dip in the mitigation behaviours that they're engaging in. It's just been a steady increase over the last 9 months.
I realise it may be a big inference, but can you infer into the numbers and look and say, well, there is some element of a step change because that was the threshold of a date being crossed on restrictions? Or do you get the sense that everybody is just growing weary and less dedicated?
So it's interesting on the step change. Throughout all of this, we haven't ever seen that once a restriction is lifted, suddenly everybody goes out and does something. In fact, there tends to be a kind of a delay and a slight wariness. So that's probably what we're seeing with this kind of a linear increase in the amount of activity that people are doing. When it comes to weariness, we ask questions like, which is more important to you? Is it preventing the spread of the virus, or is it the burden of restrictions on you? And how worried are you about that? And the vast majority of people still say that preventing the spread of the virus is more important to them than the burden of restrictions. And that hasn't really changed. And we also look at what predicts behaviour, and things like weariness don't predict behaviour. The main thing that predicts it is worry. And we have seen that worry has also been steadily declining over the last few months, but there's still a significant proportion of the population who remain very, very worried. So giving a score of 8 out of 10, or 8, 9 or 10 out of 10 for how worried they are.
So you say to them, rank on 1 to 10 how you rate your current state of worry. They say right up at the tippy top.
Exactly, yeah. And that's consistent across age groups as well.
Is it? So it's not just the people who would be more susceptible to the virus thanks to their age?
No, so there is slightly more people in older age categories who give that rating, but actually it's 1 in 3 people, or just under 1 in 3 who are under 30 who are giving that rating as well.
Do you see any reversal at any point since January? So that steady uptick in terms of people doing slightly less of the ideal behaviours, has there been any moment in which they have suddenly come back on track or begun to take it more seriously?
So I think if we had looked at this earlier on in 2020, we might have seen that. I think because since January, it's really been the case that restrictions are lifting and cases have been going down, that we haven't seen a sudden reversal. You can see dips in worry. So as cases go up, worry tends to go down. And as cases go, which way did I say down? Worry tends to go up. And you can see that in, say, the Amoric tracking data. They've been doing this since March 2020, asking a similar worry question. And you can see big peaks and troughs in that as cases go up. So it's possible that behaviour also changed as well well. We just didn't have the data in 2020.
And do you have a sense of how significant vaccines have been in contributing to people's level of worry or confidence? Because I assume that a lot of people will look at the current situation and say, well, what happened was the vaccine rollout occurred. We all got told we are the best in the world or second only to the Danes, and everybody began to relax.
Yeah, so we did see as the vaccine rollout happened that there was bigger increases in activity, but coupled with the vaccine rollout meant that people were having more close contacts, but the cases weren't rising at the same trajectory as you'd expect for the activity. We also saw that people who were unsure about getting vaccinated as it hit their age group tended to fall more into the yes, I've been vaccinated group. So I think definitely that probably has contributed to a decline in worry. We have found that people who are unvaccinated tend to be slightly less worried than people who are vaccinated, but that might be to do with, you know, the type of personality of somebody who might be unvaccinated even after it's been offered to them.
So people who have decided not to take it believe they are to some extent either immune or it won't get them, is that it?
Well, we don't go into that level of detail, but there's certainly a higher proportion. Now, it's a small difference, but a higher proportion who would be less cautious having been unvaccinated. But that might be unsurprising if you're going to take the risk of being unvaccinated, and then more likely to take risk in other areas as well.
Have you much of in the way of insight into the decision to be unvaccinated, why people decide to do it and how much they are wedded to that choice?
Yeah, so we carried out a different study in January, but bearing in mind this was before the rollout had begun, but we did really go into detail about the decision to take the vaccine or not. And what we found was that the biggest difference between people being willing to take the vaccine and not was actually a knowledge of the vaccine, so things like how effective it was and a knowledge about misinformation and so on, and also awareness of the benefits of it. So when we asked people, okay, can you write down all of the risks and all of the benefits that you think of when you think of the vaccine? People who were either unsure or said they didn't want to take the vaccine were much less likely to give any benefit. So it was like it just wasn't in their conscious awareness, the benefits of the vaccine. Now, I have to be careful saying that because this was collected in January and there was a higher proportion of people who were unsure. We were kind of at 62% of people who said they definitely take it, and of course it's now up at 90%. So there...
Oh, were the numbers that low? It was only 62 who were definitely committed back in January.
Yeah, so well, that was when we asked, will you definitely take it? But we also gave people, are you unsure but probably going to? Are you unsure but probably won't? So probably adding them all together, some of the unsure people, or most of them, went into the yes, I'll definitely take it. But there's certainly been an increase in people willing to take it, and that's been consistent across other countries as well.
Have you any insight, and maybe this is outside the bounds of the research, but the people who are in the category of the unvaccinated, committed to being unvaccinated and unaware of the benefits of vaccines, do we have any insight into their source for information? Because there's been a lot of talk, for instance, about the sort of the self-reinforcing social media aspect, that if you want to form a belief and have it reflected back to you, you can find a cohort to join. Is that a problem with the people who are resisting vaccines? Do we know?
I think possibly. We did find a pretty strong correlation between how much coverage you watch, mainstream news coverage about COVID-19, and your willingness to take the vaccine. So there probably is a group of people who are getting information mostly from other sources or not following the coverage who are more likely then to not get vaccinated.
So that if you are you get your information from mainstream media, it increases your likelihood of being among the vaccinated. Exactly.
Well, it's a correlation. So, you know, people who are more likely to follow it are more likely to get vaccinated.
Have you any sense of, when you provide this information, does NPHET, NIAC, government, anybody else, do they pour across it and say, well, this is the challenges we are facing in terms of the public, or is the public health decisions made separate to the public mood analysis?
No, throughout this, I mean, behavioural science has been pretty incorporated into decision making in Ireland. So this research that I'm talking about, the tracking survey, is funded by the Department of the Taoiseach. So we present to them every 2 weeks what the results are. So that is being made apparent. And then earlier on in the pandemic, there were the behavioural advisory committees where there was not just us, but a group of other psychologists, behavioural scientists, behavioural economists who were feeding into the decisions as well. So science does seem to have been inputted at different stages of the decision.
So as they look at the next couple of weeks and make the decision next Friday on whether or not there's a full opening up, there will be that way up that says, well, how well are people doing in mask wearing? How well are people doing in hand washing and all of that?
Well, I'm not involved in the decision making, but it'll be fed into the process potentially.